Stigma remains a significant challenge for us. Our socio-cultural situation has negatively impacted how we are able to respond to the various populations who require HIV treatment and care services. And until we are able to get that shift where we treat others as equals, we will continue to have issues with regards to stigma and discrimination in the country as a whole. We have been working assiduously with our healthcare workers just for them to internalize some of these issues and how their own personal views impact the quality and scope of services that they offer to the people that they have to serve. So we're trying to strengthen that aspect of the program whilst we try to work at a national level to get the conversations around stigma and discrimination going.
Stigma is a label. People have given you labels. So you are labeled a gay person or a homosexual. You're labeled a young child that should not be having sex. You're labeled a person living with HIV, and it's because of your bad behavior or your sexual practices why you've received it. With those labels come prescribed treatment, and that's the problem. These prescribed treatment are culturally ingrained, and so what we've been finding is that persons are continually going back to those prescribed treatments.
Are we doing enough? No. We are doing quite a lot, and that's commended, but I think there's lots more that we need to do, particularly where sociocultural and legal barriers are concerned. And so it is incumbent on us as civil society, as government, as faith-based organization, as a people, to begin to do more to ensure that we can collaborate to reduce the infections, reduce AIDS-related deaths, and reduce stigma and discrimination. But at the moment, we're doing a lot, but we're not doing enough. And a lot of the programs are disjointed to a sense. And so if we begin to combine our efforts some more, then we can certainly achieve much more.
What NFPB is doing its best to do, though, is to ensure that the barriers, to really highlight the barriers of stigma and discrimination, highlight the barriers of human rights violations that are occurring, that it leads to human rights violation. And this is important because when you look at an enabling environment, you have to look at the structure. You have to look at it from a structural and from a cultural perspective. So we are meeting them through the different agencies, but what we want is at the end of the day that everybody can go to the health facilities, public health facilities, and get treatment, care and support and prevention services right there, irrespective of who you are, what you do, who you love.
As long as we have people dying, and as long as we have 7 and 8 people a day catching AIDS, we are not doing enough. We have to do more.
One of the work that we're doing, things that we're doing around providing support for people who are affected within the community is enabling environment work. So we're doing training of healthcare workers, and we're training frontline workers, so the porters, the male and female orderlies, receptionists, customer service people, doctors, social workers, psychologists, etc. We're providing them with training around how do you provide services to gay, bisexual and other men who have sex with men. And we've been doing that since 2012, and we're doing that in partnership with the government, the National HIV Program and the National Family Planning Board. And of course we are very involved in policy decisions and discussions. So around, for example, just recently the revised National HIV Policy, we're involved in that discussion about how do we ensure that this policy is doing well. Importantly as well, what we've been doing as well of late is to get involved with the efforts around restructuring the complaints mechanism in the Ministry of Health, because as you know, a lot of people have complaints about the services that the discrimination in the facilities by healthcare workers or even by people who are using the facilities. And so we've been ensuring that at the trainings that we do, public health workers understand that there's a complaints mechanism and this is how it works. And pretty soon we'll be going into some facilities as well to help people understand how do you use the complaints mechanism, how do you understand the rights of people who are using the services, whether or not they're gay, whether or not they're sex workers, whether or not they're young people. Just how do you ensure that when you encounter and interact with people, you respect them?
Our program has been in inception for at least 30 years. So some of the strides we have made, we are actually a best practice for other Caribbean territories who are more embryonic in their HIV response. So a lot of Caribbean countries are learning from us, but as you would have seen from the statistics, we do have significant challenges with certain populations, particularly our MSM population, in terms of getting their prevalence down.